Hello, hello, hello. Welcome everybody to episode 92 of the No Normal Show for Thursday, February 11th, brought to you by Revive Health. This is our weekly deep dive into how hospital and health system marketers can navigate what we call the no normal. I'm Chris Bevelo, health systems practice lead at Revive Health and your host for the show. I'm joined by Chase Kleckner, who is senior marketing manager at Revive Health and our show's producer. Hello, Chase.
Hey, Chris. Good to see you as always.
Good to see you too. We are also thrilled to be joined by Judith Ward, who is the Vice President of Marketing and Communications at Baystate Health, the premier health system in Western Massachusetts. Previously, Judith led strategic marketing across Stanford Healthcare in Palo Alto, California, as the Administrative Director of Marketing Strategy. Prior to Stanford, Judith was Vice President of Planning and Marketing for Western Connecticut Health Network in Fairfield County, Connecticut. Judith holds an MBA from the University of Connecticut and is always searching for an innovative marketing solutions with proven ROI rewards. Love that last part. Hello, Judith.
Hello, everybody.
So glad
Good
you're
to
with
be
us
here.
today. Yeah, so glad to have you. We're looking forward to diving in. We got some really cool stuff to cover. Before we get there, just some housekeeping notes as per usual. If you're not new to the show, if you've been here before, you've heard all this. But if you're new on this podcast, this is where we share industry trends, research, stories. We hear from folks from within healthcare, like Judith, from outside the industry. Anything we can pull together to help health system marketers and communicators navigate the no normal successfully. If you want to know what we mean by the no normal, if you want to kind of dive into some principles of thriving in the no normal, please check out a blog post that we wrote last year when we launched this show. Chase will put that in the chat function so you can link through if you want to know more. Also, for the chat function, feel free to connect with your fellow attendees if you're live. It's a great place to talk to other people, put your comments or thoughts in there. If you have a question, though, for Judith or myself or Chase, put that in the Q&A queue. That's what we monitor. The chat function can get pretty lively. It's hard for us to keep track all the time. So we are watching the Q&A queue for questions you would like any of us to answer right here in the show. So make sure you put those in the Q&A. Also, remember you can subscribe to the show on iTunes or wherever else you listen to podcasts. As always, we will post a recording of the video of this show, audio as well, of course, at the end of the day. You can find that at our website at thinkrevivehealth.com/no-normal. That's where all things related to podcasts live. But you can also check out our website for a lot more content on COVID-19. We have done a ton over the past year, a lot of proprietary research, studies, blog posts, this podcast. You can find all of it at thinkrevivehealth.com/COVID-19. So we encourage you to go there as well. All right, let's dive in. Judith, we wanted to talk about the challenge folks like you and any of us really that are in this no normal, this period of ongoing uncertainty, the challenge we have with focusing on what we have to do today, which continues to kind of clip along at an unprecedented level, but also thinking about the future. Because for folks like you and others in your shoes, your job is to also be planning for what do we need to do to be successful as we move out of COVID-19 and beyond that as well. So that's what we're here to kind of dig in with you. And let's just kind of start with the today part of that, and even be a little more specific about COVID-19 and some of the things that you've been doing successfully recently around messaging around COVID-19. So we'll start there.
Sure. Well, I'll even go back to the beginning. We realized pretty early on, as I'm sure everybody who has my job, that we had to somehow get our arms around the media because that was just a daily onslaught of questions. And some of them we couldn't answer because we had no idea. And so we had to find our way to deal with that so that we could deal with like the other things that we have to do on a daily basis. So very early on, before we even had a COVID patient in our hospital, we had a press briefing with some of the larger publications in our area. And really what we did with that is to join hands and let them know that we were going to partner with them on giving transparent, real information as quickly as we could through them, so that during this public health crisis, we weren't creating more of a stir in a market, but really trying to help our constituents get through this. So that was our charge from the very beginning, and I think that our media partners really appreciated that. And what happened was we were able to, really kind of contain some of the scurry that was going on. Because if we all kind of go back to that time, it wasn't just around COVID that there were many questions and 50 different answers to the same question. It was everything. That was just kind of the culture that was out there. So we did that very early on. We built a lot of trust and transparency. We put our CEO out there. We put our incident commander, who both are infectious disease doctors. So we've been really fortunate at Baystate, because several of our high-level executives are infectious disease experts and have gone through, anthrax and all sorts of things. So,
Yeah.
and AIDS, our CEO was with HIV and AIDS. So they've done this before, they've seen this before, and the structure that we took on was very intentional. So that's what we did in the very beginning. And so we were able to kind of control a little bit of the message. So we were out there proactively telling the media, what we knew. Things were changing. They still are, like, daily, but we were, informing as those changes came. And when we had big news, what we did was we set up a structure for media briefings on Zoom, of course, because everything went virtual. And what we did was we invited all the press. We sent out an invitation. We collected RSVPs. We took note of how the RSVPs came in, and we let the press know that we were gonna, you could ask questions in the order from which your RSVP came in. And you could ask one question. And then when we got through the list of attendees, we went back to the beginning and we did it again until they were done asking all their questions. And honestly, this was like the best thing that we did, because, the media, they all have the same questions.
Right.
So we didn't have to answer 25 phone calls with the same question, because they all heard the question and the answer at the same time, and they could ask a follow-up question if they wanted to. They all got the information at the same time. It was consistent. And so we were able to kind of control the fray with that setup. So, for the hour amount of time that we had setting, going through those, we probably saved, 15 hours in phone calls. So that's something we're gonna continue to model going forward, because it just really has kind of helped to control the message and to cut down on the back and forth with media calls.
So I imagine that super helpful in the beginning, because a year ago, we're almost up to a year when this really blew up, right? I think middle of March is where it started to become real at a national level in an intense way. It was just chaos. It was just chaos. And, you'd like to think that we would have moved past that, and we did. But I think, talk a little bit about how that served you now, because we're in a different kind of chaos now. We're the vaccine chaos, which is, equally challenging, I think, in some ways.
Yeah, so now we're into the vaccine unknown. First, we were in COVID unknown. Now we're in vaccine unknown, and which is, actually kind of a little bit harder, I would say, because, the vaccines are being rolled out differently in every state. At least when we had the COVID onslaught, it was kind of like it was the same enemy. It was just arriving at different times. And then, now that we have the vaccines, it's just, we have people who are watching the national news, and Massachusetts is very conservative, and there are other states that are further ahead, and people don't necessarily understand why that is. So so what we set up in the trust and transparency with the press that we did in the beginning has served us well with this, because now we actually have partners who can help us get the message out. Because the challenge is that, for us being in a conservative state, and having other states, we're on the border of Connecticut, and Connecticut is actually further ahead. People don't understand. It helps. We're in a position where it makes us look kind of bad. Is it Baystate Health that is holding back vaccines? Like, why aren't you guys giving out vaccines like, the folks over across the border? So having those media partners help us to get the real message out there about, how it's different where we live, and how it's going to work. The state now has, they have their own COVID vaccine page. They have their own way to navigate to get an appointment. We had actually set up our own way for our employees, and then for first responders, and going into those individuals who are 75 plus. But every health system has a different way. So
Right.
we really need those our media partners to get out there, because that's what people believe. People
Yeah.
believe PR better than they believe an ad in the paper, per se.
Yeah. Yeah, for sure. And it's just, we talked a little bit about this before the show. It's just such an unfortunate situation because, just the idea of vaccines alone is difficult. Vaccines developed the way they had to be for this is difficult. The importance of all this is difficult. And the idea that we have set this up so every state is basically approaching it. I mean, they're trying to follow guidelines that were set nationally, but they're doing it, to your point, at different paces. The fact that you're on a border, right, of a state makes it more difficult for you than other situations for other hospitals and health systems. I mentioned to you that we have an employee whose mom is right on the border of two states, and her clinic's across the state, but because she lives in one, just to introduce that level unnecessarily, honestly, of confusion, just is so unfortunate. We joked about, uh, and we said this before in the show, this is like the United States is at war with somebody, and we're asking each state, like they have their own militias, like back in the revolutionary days. It's like, hey, come up with your own muskets and your own ammo, um, and then do your best. And Connecticut may be doing really well, and Massachusetts may be doing different, and you're on a village in the middle. Like it's kind of nuts, and I don't know that it's really going to change dramatically, even though there's talk of it changing quick enough for it to have an impact the way we'd want.
Yeah. And just to layer on to that, Chris, just to think about, it's not only the difference between how different states are handling this, but then you throw in all these different vaccines. So like first we
Mhm.
had Pfizer, and that was like easy. Okay. We have one vaccine, and then you threw in Moderna, and then it was, we were still on like healthcare workers and first
Mhm.
responders, but the conversation started, well, which one should I get? Should I choose Pfizer or should I choose Moderna? And now we have J&J coming down the pike, which is really going to throw some questions into the mix here, because there's going to be a lot of people who say, well, I'm going to wait for Pfizer and Moderna, because their percent effectiveness is much higher than Johnson and Johnson. But then there are people who will say, well, I'll do Johnson & Johnson because I only have to get one shot, and I can go to, multiple places. So it's just going to add in this whole other level of kind of consumer choice that people are used to, and they want to be able to choose, but will they be able to? And then you have the whole level of people who are avoiding the vaccine
Right.
altogether, and the messaging that goes along with that.
Yeah,
So
it's
very
it's
complicated.
it's complicated. It's only going to get more complicated as these variants start to emerge, and the pharmaceutical companies have to come up with boosters to deal with the variants. In my state, in Minnesota, we have a pretty well-known epidemiologist. I think that's the right phrase to give
Yes.
him. Michael Osterhaus, I think is his name, from the University of Minnesota. So he's on national news networks, and you hear from him a lot. And he's come out and said, forget about the second shot. We need to forget about the second shot. We need to give those second shots to more people because we got to get out ahead of the variants. Now, he's saying that, but not our governor. The governor is not saying that. So you've got two well-respected people just in our state, right? So it's not even between states, it's within states that you're hearing this difference.
Yeah. And the way that we've handled that is really, we are very adamant about the fact that we're following the state of Massachusetts and the Department of Health and the CDC guidelines. So we've done that very much from the beginning, where we haven't really kind of put out our own, everybody has their own kind of thoughts on some of these, even from the beginning with like how it was spread, and so we've really we made a decision early on that we were really just going to follow the state guidelines and the CDC guidelines, and we were going to stick to that. So, if you go to our website, to our vaccine page, there's a lot that changes, like locations of testing, and we have frontline story. We have a lot of content on there, but when we get to kind of the clinical call outs, we refer right back to the Department of Public Health, because we didn't want to get into those kind of discussions. Because again, you may think something today, but tomorrow it'll be proved wrong. So it's a tough place to be. So that's kind of how we intentionally handled it.
Yeah. So let's talk about tomorrow, right? So we wanted to kind of talk about 1 foot in the present, trying to get 1 foot in the future. And I think like the way to set up this part of the conversation, Judith, is we're very honest about, up until maybe the turn of the year, so the beginning of the year, for us, we saw the spring being kind of the light at the end of the tunnel, where we've got the vaccines. Going into warmer weather may or may not affect the disease itself, but people can get out more. We just saw that as like, okay, that's the beginning of the end. Then the variants started hitting, and we started getting these dual kind of, we're doing good now, but it could get even worse depending on how these variants hit, right? One of which is 5 times more likely to spread. It's not necessarily more lethal, but just being 5 times more likely to spread could overwhelm our health system, as an example. So now we're wondering, well, can we even be thinking about tomorrow as the beginning of post-COVID in the summer or the fall? There was an article we talked about a couple episodes ago from Axios, where some of the folks were saying, look, 2022 at the earliest. So how do you, as a healthcare marketing leader, knowing that tomorrow is a very squishy concept, try to plan for how you're going to come out of this or what's next? How are you thinking about that?
Yeah, so we're kind of in an interesting position with that. And so right before, well, not right before, probably a year before COVID hit, we had come out with a brand new branding campaign, where we had, done all the research and all the right things. We had it a wonderful production, and it was based around patient stories, and really focused on us being a trauma center and some of the cool surgeries we do and all of that. And as soon as, kind of COVID hit, we pulled it. And And then we went into, you know, the same thing everybody else did, stay away from the hospital. And then it was like, no, don't stay away if you're going to have a heart attack. You need to come to the emergency room. And then we had keeping, you know, we're keeping you safe. These are the things we're doing to keep us all safe. And then, you know, once we kind of got into the spring of last year and the summer, when, you know, our numbers started to go down because everybody was outside and things of that sort. As part of the incident command group, we set up kind of this post-COVID planning groups, where we kind of went through the service lines to figure out, okay, you know, if we need to get people back into the system, like what, you know, what are we going to do? So we had several months of planning around those efforts, where we did a lot of kind of, some of it was very transactional marketing to get people into like get back to primary care and use urgent care if you need it. We did a push with our heart and vascular services, because we were finding a lot of people had put off this crucial care. And honestly, what we experienced during that time was that there were so many people who had put off that critical care that they kind of, like, our emergency room volumes started going up, and then the percent of people who ended up in an inpatient bed from the emergency room went up, because it was like this backlog of people. We also had a campaign where we called all the primary care patients who had their appointments canceled, just to keep the dialogue. How are you doing? We used the time to actually fill in any of those clinical record items that were missing. So that kind of kept the conversation warm and kept us top of mind. Now we're finding that our numbers are, knock on wood, starting to go down now as people are getting more people are getting vaccinated, and of course, there's a lot of people who are immune because they actually had COVID-19. So our numbers are going down a little bit, and now we're getting into more of the, okay, now we really need to get into the strategy. And my challenge has been that I want to, at some point, I know I need to flip back into that branding schemata that we had in the beginning, which was working really, really well. But how do you do that when you can't have a TV production company come into the hospital, and you can't go into people's homes, and you have, you know, we need to have the masks so that we can, our reality is different now. So we're currently working through how we can do that in kind of a clever virtual way, because there's going to be this period where we have to produce it while we're still in this, and let it fly, hopefully when we're almost out of it, and then we could probably go to a next generation. So that's kind of the way that I'm thinking of it. In the meantime, what we're doing is meeting with the service line chiefs and chairs to revisit strategy, because we're in the middle of a 5-year strategic planning process. So I want to know, you know, what is it in heart and vascular? What are you focused on? What are your goals? What are the procedures you're focused on, so that we can develop marketing campaigns that are really targeted at those very specific goals. And then we're going to have to figure it out from there. I mean, I think one thing we've all learned from this is that, you know, we can, every time I plan for next week, it's like, no,
Right.
that's not going to happen. We got to go back and do something else. But at least we're starting those conversations back up. And those are conversations, you know, we used to have pre-COVID, you know, on a quarterly basis, but we're starting to have those again, and really figuring out how to put these puzzle pieces together. And in the meantime, before we can get to kind of the, you know, the sexy TV, radio, digital campaigns, we're really taking kind of a workhorse kind of a strategy to this, where we're taking those things that need volumes now, and we're figuring out how to get the message out, whether it be through our physician referral channels. We've done a lot of, we've used a lot of the time for people who haven't been like on the COVID vaccine line, doing, catch up on SEO, and, how is our landing page strategy, and, what are we doing with our physician profile? So we've done a lot of foundational work in the meantime, so that when we're ready to roll, we're going to be much more ready than we were the first time.
Yeah.
So that's how we've been tackling it.
Yeah, I think we should all, like, right now, place our bet on what will come next week. I love what you said there. Like, I'm going to put my bet down on the Portuguese variant. I think next week we're going to hear about a Portuguese variant that's going to disrupt all of the plans that they're making, Judith. One thing that I think we do have to think about this a little. It's very nuanced. It always has been in what we do in terms of how we go after patients and patient acquisition and service line marketing. The approaches we take are different than brand building. We want them related. We want them aligned. But when I think about what we have to do with the service line marketing and the patient acquisition, that just has to continue to go, unless, God forbid, we're in a situation where we have to shut things back down again, right? It's the brand work that it feels like the kind of, put your finger in the air and test the wind test is it going to, when is it going to be weird to have that talk about COVID, right? Because right now it would be weird if you didn't address COVID in your
Right.
overall messages. And I think what's really interesting is if you looked at the Super Bowl, like, a lot of people watch the Super Bowl for the commercials as much as the game. And so here we have, a week ago, one place where you've got all of these commercials from all these different places, and you had a mix. You had some that, I mean, you had no idea there was a pandemic going on from the ad, and others that were focused on it, right? And I'm not sure it was, I don't know that I felt uncomfortable or that it was weird seeing commercials that didn't address the pandemic. In some cases, right, if it's Tic Tac, good. Like, I don't want Tic Tac to talk to me about a pandemic. It's not appropriate. But there's certainly worse situations where it's like, well, that's weird. Nobody has a mask on. And I think for us in our world, it's a different story. We are at the heart of this pandemic. We're not Tic Tac. We're not Coca-Cola. We're not somebody else who could potentially talk about their brand in a way that isn't alluding or even referencing the pandemic in some way,
Yeah.
and maybe get away with it. That's going to be really hard for us to do anytime soon, I would think.
Yeah. And I think some of us may have, and we're actually going to be doing some market research around this, but the way we tackled it in the beginning was, setting our execs up and our physicians up as the subject matter experts. And, it was kind of like we wanted our CEO to be like the Fauci of Western Massachusetts, right? So we started with that trust and transparency, and we put that out there, and I think we made huge progress. We had the media, every month they would have the CEO on, and so it was really great. But now we're in this vaccine world where I can see some of that slipping away, because we have people calling us for, well, why can't I get in for a vaccine? Well, you know what? We're only getting 2,000 a week. We can't, there's only so many we could do. So so some of our brand moving forward is going to be a repair. We're going to have to repair some of those relationships that we had so much in the beginning. And now, I don't know where we're going to fall, but there's going to have to be something around, how do we sort this all out so that we can end up, in the position that we were before this all started. And, I couldn't have predicted that 2 weeks
Right.
ago or 3
That's
weeks
right.
ago. I was like, oh my God, we're so great, and everybody's calling us, and we're, and now everybody's calling us, but we're not making them happy. So
That's
So
right.
that's going to be the challenge, I think, for us.
Yeah, for sure. And we've talked about this on this show. Um, I don't know how many hospitals, were there like 2,000 hospitals or health systems in the country. Um, there's a lot, right? And they're all approaching it differently. But about on a weekly basis now, we are still seeing the, oh no, they stepped in it story for a hospital that, sent out a special VIP vaccine invitation to their top donors. We just saw one last week. I can't remember what it was. And each time it's like a new variant of it. So it's like a new variant of this, terrible disease of hospitals not handling it right. And it's still probably less than a dozen total, but it starts to add up. It starts to in the public's mind, depending on how widespread these stories go, um, the individual unfortunate situations start to equal hospitals and health systems, and everybody pays the price for some of these that have not been handled well. And so, that's the other part of it too, is that for the vast majority of hospitals and health systems that are doing the right thing, they're being held accountable for peers that may not be doing the right thing, for state governments, for the federal government, for things that are out of their control. But to your point, Judith, at the end of the day, brand and reputation is as much about perception as reality. And
Right.
you've got to figure out a way, because you're right. 2 weeks ago, most of us thought, how are we going to hold all this equity that we've got? And now it's like, oh man, can we get even back to where we were before the the
Right.
pandemic? Not for everybody, but there's a danger that it gets worse. So something that certainly will come before we're able to kind of move beyond COVID brand messages. I think there's a question for you. I want to throw this out to you. So the question is, do you see your patients still delaying clinical care, and do all of your marketing messages still stress safety?
We do see people still delaying care, for sure. So that is a message that we are still putting out there. Um, and really, it's around patient stories, and we're doing a lot with physician outreach too. Uh, and honestly, I think at this point, we have an older population here in Western Mass. So unfortunately, there's a lot of people who are ending up in the emergency room, like I said before, because they did delay their care. So we're trying to tell those stories so that we can get that out to the public. We also have a very robust community mitigation group. So, which is actually kind of cool because it's not just Baystate people. We've collaborated with many community members, and we meet weekly, and it's about inequities in healthcare, and also kind of getting that grassroots messaging out there. And we've set up a portal that we can all get into, and we dump information in there so people can go out with the same speaking points and all of that.
Mhm.
So we have really been pounding the streets on that to make sure that everybody's kind of getting the care that they need. So done a lot of work on that. As far as keeping us all safe, we're not really. We did go through this forced another change for us, where we noticed when we were looking at our keeping us all safe messaging that we had, I don't know how many renditions of patient touch point, like reminder letters and
Mhm.
scheduling pre-op information. We had so many touch points of patient information and letters, and some of them had been written like 25 years ago,
Mhm.
and or had been copied like 150 times, so it was askew on the paper. And so we took the opportunity to go through all that messaging and standardize the tone of it. And there is a piece in there about how we are, thank you for being our patient, and this is what we're doing to keep our patients safe. We kept it not so COVID-19 focused, because That was a really big process to change all that. And as you can well imagine, they all came out from different systems and some reprogramming and all of that. But it did offer us the opportunity to put that in there and to kind of update our messaging that was out there. So that was kind of a silver nugget. But as far as putting out ads and things like that, no, because I think at this point, consumers expect you to keep them safe.
Yeah,
So
I think that's
we
right
don't
too.
hammer on that.
Yeah, and I'll just add to the question of delaying critical care. Obviously there was a huge concern about that in the summer as people started opening up. Most health systems saw a very rapid refill from the pent up demand, but there has been still a level of delay, to your point, Judith. And what we were worried about then, and still are worried about, as much as the delay of critical care that people need now, is the delay of more routine care that's much easier for people to put off, because it seems more innocuous. Like, hey, I can put my physical off, I can put my 6-month diabetes check in off, all those kind of things that are up funnel of the critical work. Uh, but as that continues to be dampened, that's just going to be a drag on that critical care down the road, ongoing, right? Until we get to a place where people feel comfortable. Yeah, why not come in? There's no harm in coming in now for those things that are super simple and seem less acute. That those dominoes aren't going to be falling like we need them to fall. So we're still very worried about that, from what we see across the country, and from what we hear from clients. So I would just add that to that. Well, Judith, let's wrap there. We really appreciate you joining us today.
Oh,
Thank
well,
you.
thank you for having me.
Yes, it's always great to have folks who are living this every day. It's easy for Chase and I to come on here and say, like, this is what we need to do. But to hear from the people that are actually on the ground dealing with it, I think is super helpful to our audience. So thank you so much for joining us.
You're welcome.
Chase, as always, sir.
Yeah, enjoy the conversation.
Thank you. Thank you to everybody who attended. If you would like us to cover something that you didn't hear about today, whatever you'd like us to cover in the future show, let us know now, put it in the chat channel. Or if you're listening in later, you can email us ideas at nonormal@thinkrevivehealth.com. Don't forget to visit thinkrevivehealth.com/COVID-19 for all of our COVID stuff. You can also access the episode that we'll put up later from that link. Don't forget to subscribe on iTunes or wherever you're at. At our podcast page at the bottom of it, you can see who we've got coming up. Next week, we have Amy Kamau, who is the VP of Marketing at Emory Healthcare in Atlanta. So tune in for that. Thank you for joining today. And as always, good luck out there in the no normal.